This is CNC World, a new perspective.
World AIDS Day is held on December the 1st every year. It tries to raise awareness about HIV/AIDS and demonstrate international solidarity in the face of pandemic. The day is an opportunity for the public to know more about the pandemic and encourage progress in HIV/AIDS prevention, treatment and care in high-prevalence countries and around the world. On this year's World AIDS Day, the UN celebrates dramatic progress over the past decade.
In 2011, 2.5 million people were newly infected with HIV. An estimated 1.7 million people died. That is 700,000 fewer new infections worldwide than 10 years ago and 600,000 fewer deaths than in 2005. Given the spread of the epidemic today, reaching the goal of zero new HIV infections and zero deaths from AIDS-related illnesses may sound difficult. But the World Health Organization says significant progress is underway. Much of it is attributed to the life-saving medications called antiretrovirals to treat those infected with HIV. Currently, 8 million people in low and middle-income countries are accessing the treatment they need, up from only 0.4 million in 2003.
We're seeing impressive global progress in the response to the AIDS epidemic. Fewer people are dying, fewer people are getting infected, and many more people now have access to life-saving treatment. 8 million people in 2012. We are now getting confident that we can achieve very ambitious targets, such as the 15 million people on treatment by 2015.
The UN Children's Fund, UNICEF, said an AIDS-free generation, once seemingly impossible, is now within reach.
Such dramatic progress has occurred in the past decade. For example, we've gone from virtually no one in need of treatment receiving it 10 years ago to over half of all adults throughout the world that need treatment receiving it. But when we talk about an AIDS-free generation, I think we really need to address the fact that a new generation free of HIV, free of AIDS, must begin with children. Children, mothers, fathers.
In all regions of the world, some groups of people are still not able to access HIV prevention and treatment. Children, for example, are lagging badly behind. Only 28% of children who need antiretrovirals can obtain them. Only 57% of the estimated 1.5 million pregnant women living with HIV in low and middle income countries received effective antiretroviral medicine to prevent mother-to-child transmission of HIV.
This is life and death. And we need to keep driving through to the finish line, not just to prevent more children from being born HIV positive, where we are making progress, but also to do something about the some 2 million children around the world who are HIV positive and who need to get on medications, and only less than a third of them are getting that compared to over half of adults. That's morally wrong and is practically wrong, and we need to use that to keep pushing us to the finish.
The WHO has proclaimed zero discrimination as the theme for this year's World AIDS Day. It says stigma, discrimination, and legal issues are often significant barriers to accessing effective care. Adolescent girls, sex workers, men who have sex with men, and people who use drugs often remain vulnerable and marginalized. Migrants frequently have only limited access to health services. As a result, they often struggle to obtain the health services they need, including the provision of antiretroviral therapy.
The important thing is to sustain the momentum now and to ensure that nobody is left behind. Wherever somebody lives and whoever somebody is, we need to make sure that these persons get treatment and prevention services.
One of the WHO's priorities is to help countries move closer to a universal health coverage. The organization works with partners to combat the stigma and discrimination. It supports countries in improving service delivery in all geographic areas. For example, it's increasing access to medicines and diagnostics through mechanisms to encourage health workers to work in remote areas. It supports the establishment and maintenance of financing mechanisms that ensure that no one is thrust into poverty because they have to pay for services out of their own pockets.
This is CNC World, a new perspective.